I'd like to welcome everybody to the Aptitude User Forum. I'm Dr. Martin Lucenti. I'm the Chief Medical Officer for Vizient. I'm an ER doc with a PhD in industrial engineering. I do a lot of work around helping health systems solve capacity problems. And the other part of the work that I do for Vizient is I help health systems establish governance models, both for their service line operations, but also for their strategic sourcing functions. What I wanted to do today is, in addition to welcome you to the user forum, I wanted to talk to you about what you do and why it's so important to healthcare right now. For context, as you look at the ever escalating cost of healthcare, what really stands out as you look through this and see what components have led to the rise in the cost of healthcare, what you see in the United States, it's not that there's a substantial increase in service utilization. It's not that disease prevalence has increased. There is some contribution as our population has aged and as our population has overall grown. But the leading cause of the increase in the cost of healthcare is really actually the unit cost for the provision of care has gone up and up and up. And if you look, at that in recent times, it's become even more predominant. We've gone through a series of mergers, acquisitions, consolidation in healthcare. What was a mom and pop operation across the country has become a very large industry. And to some extent, the healthcare industry is going through its own industrial revolution. Now, what we've seen with those mergers, acquisitions, as we've gotten scale, the thought was that would actually decrease the cost of providing care. But what we've seen, at least in the early phases of this consolidation, is that it has enhanced the leveraging power in negotiation with payers, which has contributed to rising costs. But we've struggled to actually capitalize on the economies of scale to actually drive down the cost and the provision of care. And the only way we're ever going to be able to do that is to really start to leverage the economies of scale to get some standardization of or commonality of practice, both in the clinical and the non-clinical operations within healthcare. As you start to look at it, there's really two big buckets to spend in healthcare, right? There's the labor, which really represents more than 50% of the total aggregate spend, and then there's the non-labor. And as you look at those things, we have the highest percent GDP spent on healthcare and the highest per capita cost spent on healthcare. And as bad as that is, we've seen a really, really profound increase and escalation in the cost of the labor side. With the nursing shortages that accompany the pandemic, the challenges on the labor side have escalated, making it all the more important that you have rigor and a systematic way of driving down that non-labor cost and spend. To give you a reference point, the cost of an hour of nursing labor now relative to pre-pandemic has gone up almost 50%. Many hospitals, over half the hospitals in the US today, are actually operating on a negative margin. So it is imperative that we can actually start to leverage the economies of scale that we aspire to achieve in the consolidation of healthcare, and to really start to drive down those costs. In order to drive down those costs, though, we've got to be able to create an organized approach to do strategic sourcing and custom contracting so that we can get commonality of both clinical practice and commonality of non-clinical practice in the healthcare setting to leverage and to achieve cost optimization. The challenges are, as I said, in the labor are profound, but they're equally challenging on the non-labor side with both CPI and PPI growing in high single digits over the last 2 years. These challenges are really profound. As you start to look at it, in order for a health system to be successful, you really do start to have a real solid framework around which you attack your spend optimization. As you look at this wheel that we like to use to kind of give a framework to the whole thing, there are a whole bunch of considerations that you need to really focus on as you do contracting, as you do strategic sourcing and custom contracting on the behalf of a large health system or any healthcare entity. You've got to make sure that you're achieving price assurances and all of those things, reliability, that you're meeting quality indications and all of those things. And then you've got to have strategic approaches to engage your stakeholders and to manage very different books of spend, whether it's clinically sensitive items to commodities, to purchase services, to things over in capital. All of those things have nuances to which both sourcing and contracting need to be responsive to. And then finally, you've got to determine where you are in your journey as an organization to systemness so that you contract either just to get access to these things or you actually do that contracting as part of a standardization initiative. All of these things become the nuances that are important in strategic sourcing and custom contracting. As you look, the things you're trying to optimize while you're doing this sourcing and contracting have also gotten much more sophisticated, right? It's really important to start to think about the economic impact of the spend that you have and its implications on diversity and spend. The challenges of the pandemic have made supplier assurance and assurances of inventory levels really imperative. So the days where it was mostly a cost optimization and a one-dimensional decision making are behind us. You have to look at all of these different facets of the dynamics of your contracting operation to be successful for your organization. When you start to put all this together and say, hey, how much can strategic sourcing, custom contracting, how much can we drive out of the cost of provision of healthcare? We like to think of this in a couple different buckets, but when you really have sophisticated strategic sourcing and custom contracting, all of these dimensions are considered when you're doing that pre-work and then ultimately doing the contracting operations. First, there's price optimization, getting the best possible price in the unit cost of an item, a widget, or a service. Okay. Next are efficiencies, and those are things like inventory management, automation of procurement, and even automation of the contracting operation, as you've seen. We built into the aptitude tool. And then finally, really having a sophisticated dynamic in your strategic sourcing that takes a multidisciplinary approach with heavy involvement and leadership from the key stakeholders to really make sure that you're getting value out of all of those things that you're contracting for and using. We truly believe that there is substantial cost savings available if we can go through that systemization of healthcare, if we can go through and mature through an industrial revolution customized to healthcare. When you look at that, there are a lot of capabilities that are very core to a system to do strategic sourcing and custom contracting. And to be good at this, you need talents and capabilities on all four of these capability fronts. The first one is engagement to your stakeholders who ultimately need to drive. When you think about things like clinical items, if you're going to drive out the non-value added cost in the provision of healthcare, that endeavor has got to be led by your practicing clinicians. There's no difference between that and what you really need to do over on the facilities front, on the construction front. Same basic dynamic. It is getting a leadership component from your stakeholders with a multidisciplinary source to make sure that you're looking at all the facets and all the implications. So the first part is that engagement. The second part is you've got to have analytic infrastructure to provide your decision makers with the insights and perspectives that they need to truly optimize this spend. You need to be able to provide them with benchmarking. You need to be able to provide them with utilization patterns and the subsequent outcomes based on those utilization patterns. And you need to have technology to assist in monitoring those things. All of these things you can start to see are some of the capabilities that we've started to build into Aptitude. And the ability to monitor the contracting and the utilization patterns after the contract, and to manage the relationships with the vendors. All aspects of that analytic infrastructure to support that engagement or governance model in the process of strategic sourcing and custom contracting are a must. The next is really having a mechanism to pull together all that evidence and all that knowledge, so that in addition to the analytics and the benchmarking and the utilization patterns in your organization, make sure you're monitoring the literature and all of those things that need to, and all of those studies that need to be brought to bear as you're making these decisions. And then the final part of that is you need to have sophisticated processes to introduce new technology and to review them to make sure that they're value added. You need change management processes. You need processes to govern, trials, clinical trials, and research initiatives. You need processes to govern and to support, value analysis. So, in order to be successful, you need to pull together both capabilities on the engagement and governance front, on the data and analytics to provide insights to your decision makers, on the knowledge presentation to bring to bear all of that literature that needs to be fed into a decision, and ultimately a rich set of governance and change management processes to enact and facilitate the effectiveness of the decisions made out of these governing bodies. As you guys start to move forward, this is a challenging time and a challenging context. Our roadmap for Aptitude is led by and influenced by our understanding of that complex framework that we believe is imperative to be effective at strategic sourcing and custom contracting. And you'll see as we move forward, Aptitude will continue to migrate to be more and more effective to help your health system go through its industrial revolution, its establishment and leverage of economies of scale to do very sophisticated strategic sourcing and custom contracting to drive out the non-value added cost in the provision of healthcare. We hope you enjoy the rest of the speakers that you're going to see over the course of this symposium. Thanks a lot for your time, everyone.